Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Functions of parietal lobe. Okay, parietal lobe, the main functions are there is cortical functions are important in parietal lobe. So that means in the cortical functions we have 2 point discrimination is seen with stereognosis, graphesthesia, and there is touch localization. So these are the cortical functions, that is 2 point discrimination, being able to differ 2 points. This can be done by an instrument like a compass is taken, and if you put those 2 points together, those two parts of the compass on the patient's hand or different parts of the body, and the minimum distance that the patient can recognize, that is 2 point discrimination. Stereognosis is the patient has to recognize the object when placed in hand while the patient is closed. That means you will first ask the patient to close his eyes. Once the patient has closed his eyes, you will put a pen in his hand. If the patient recognizes that it is pen, then the patient's stereognosis is normal. Third, graphesthesia. In graphesthesia, you will have to ask the person to close his eyes, and you will draw some numbers or letters on the hand of the patient. Now the patient has to recognize the number or letter which you have written on the patient's hand. If the patient did not recognize or could not recognize the numbers, then the patient has abnormality in graphesthesia. Third, touch localization. In touch localization, you will ask the patient to close the eyes, and you will touch at some point, at some part, or at one point on the patient's body. If he could localize the point where you have touched, then he has normal function of parietal lobe.
thank you and thank you for watching.